back. We have continuing coverage now on the deadly Hantavirus outbreak on a cruise ship as concerns have heightened across the country. Joining us now to help sort through those concerns is Dr. Laurie Forlano with the Virginia Department of Health. Thank you so much for joining us today.
Sure, thank you for having me.
So break this down for us. How many Virginians were on that ship, and also how long will you be tracking their health? We know at least one of them already home isn't showing symptoms.
Right, so I'll start by saying it's a dynamic situation, so information unfolds pretty quickly throughout the day. We are aware of the one Virginia traveler who has returned home. Information about additional travelers is still forthcoming. I anticipate we would receive no more than 2 or 3 Virginians.
Okay, and then as far as how long you'll track them, is there a time
Sure.
frame for that?
Right. So the guidance is that folks returning home would be monitored, for signs and symptoms of illness for up to 42 days after their last exposure. We would need to talk to them and interview them to determine the exact timing of that, but that's the general time frame.
Now, there's some debate over whether they should be quarantined. What's the health department's take on that?
So the public health guidance right now for these individuals is first we would interview them. We'd want to gather information. We would assess the level of exposure that they had in their risk. And depending on that information, public health monitoring, so that's symptom monitoring, which happens on a daily basis, and then potentially some what we would call modified activities. So this might be that the person can go about their, generally speaking, their regular daily activities, but we might ask them to avoid certain situations like crowded places or things like that. But we need to get a little bit more information from these people before we would advise.
Right. And Dr. Forlano, after living through one pandemic, we want to calm fears and also inform at the same time. How is transmission of hantavirus different from COVID-19?
A very common question, so I'm happy to answer it. So typically hantavirus is transmitted through contact with rodents and their feces or urine. In this particular situation, the Andes hantavirus is known to transmit from person to person, and that's what's suspected to have happened on this ship. So it would require prolonged close contact with an individual who was ill and infected, which is different than other types of respiratory viruses. So although it can transmit from person to person, it would require that close, prolonged contact.
And what does treatment look like for this virus?
Right. So, it's a very serious illness, hantavirus pulmonary syndrome, which is the respiratory clinical presentation of this illness. It's a very serious illness, starts with kind of mild illness, flu-like symptoms, but then quickly can progress and would require intensive care in a hospital. There's no specific treatment, but it would be supporting that person's through their respiratory function and capacity.
And so that would also mean there's no vaccine, correct?
There is no readily available vaccine for hantavirus. That's correct. So no specific treatment, supportive care, intensive care. That would be the general course of care. It can be deadly. Up to 38% of people who have that pulmonary syndrome, unfortunately, can go on to die.
Well, this is all really good information, and we thank you so much, Dr. Forlano, for joining us. I'm sure we'll be talking again. Dr. Forlano with the Virginia Health Department, thank you for joining us today at 4.
Thank you.